Hello, sir.
Hello.
How are you?
I'm fine.
My name is Nurse Rosalind.
Okay.
As you can see from my badge, I'm going to be your nurse for today. And today I'm going to do your heart assessment, your cardiovascular assessment. Do I have your permission to record you?
Yes.
All right, so I will need you to sign this permission note for me.
Okay.
All right, thank you, sir. All right. So how have you been?
I'm good.
All right. Nice to meet you today. All right. So I'm looking at you. I see that you are breathing normally. You are not using the accessory muscles, the neck, the abdomen to facilitate your breathing. Everything, your breathing is normal right now, which is very good. Which is very good. Let me look at your anterior chest as you breathe. Come around. And I'm looking at your posterior chest as well. So the anterior and the posterior diameter, looking at it, and then the transverse part of your chest. The anterior posterior diameter is half of the transverse chest, which is very normal at this time. All right, I'm gonna raise your head up a little bit for me. Okay, no, not all the way up like that. Okay, I'm going to check your carotid artery, okay, for your pulse over there. No, you don't move it, it's like that. Very good. Now check this right side here. Very good. The pulses over here on your carotid artery is a 2+ strength. Bilaterally, both the left and the right has the 2+ strength, which is very good. I'm going to check for any lymph node tenderness here. Do you feel anything tender here in your clavicular area? No?
No.
Okay, that's very good. Okay, I'm going to percuss your chest for the sound.
Okay.
All right. How it resonates. Okay, thank you so much. So, and go in that manner. Good. 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 The anterior part is very good. Good. I need to check the posterior part as well. Thank you, sir. All right. I need you to sit up straight for me. Good. All right. Good. 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 That's very good. All right. That's very good. I'm going to listen to your breathing whilst you are sitting up there. I'll check the posterior and I'll come and check the anterior when you are done. All right. I'll use the diaphragm part of my stethoscope to listen. Breathe in for me and out through your mouth. Good job. Good job. Good job. Good job. Good job. Keep breathing. Good job. Good job. Nice one. All right. That's very good. Thank you, sir. I'll check the anterior part. I'll check the anterior part. All right. Breathe in for me. Good. Breathe in. Breathe in. Breathe in. Breathe in. Keep breathing. That's very good. All right. Okay. Good job, sir. Your lungs sound very clear, both anteriorly and posteriorly on all the lobes as I auscultate. That's very good. I would need you to lie down for me. So I'm going to get you some pillows to elevate your neck to a 35-degree angle,
Okay.
so we can do the rest of the assessment.
Okay.
I'm going to check your jugular vein. So turn to this side for me. Come closer. I'm going to check the jugular vein. All right. It's flat and not distended. Turn to the left for me. All right. It's flat and not distended. Thank you, sir, for that. All right. I'm checking you breathe and checking the rise and fall of your chest in the area. There's no heaves. I'm looking at your skin color. All right, your leg and everything. There's no discoloration. Your skin color looks normal, no paler, no tremor, no jaundice. Your eye. Let me look at the mucosa in your mouth. No cyanosis of any sort like that. All right, I'm going to check for pretibial edema on both legs. Pretibial edema on both legs. All right, there's no pretibial edema. I'm going to check all the pulses. I'm going to check all your pulses, starting with your brachial. Good. It's a 2+. Let me see that. It's a 2+. That's very good. I'm checking the radial pulse. That's also strong. 2+. That's very good. So your brachial and the radial pulse are 2+ bilaterally. I'm going to check the dorsalis pedals. It's very good. And check that one too. It's very good. I'm checking the posterior tibial. Very good. Checking this one too. That's very good. I'm checking the popliteal. That's very good. I'll check this one too. That's also good. I'll check the femoral. Which is very good. And whilst I'm in there, I'm going to check your inguinal area to see if there's any lymph node tenderness. Please let me know if you feel any tenderness over where I'm palpating. I'm checking, okay? Is there any tenderness?
No.
All right. That's very good. All right, that's very good. I'll do hand hygiene. All right, I'm going to check your capillary refill by checking the fingernails. All right. That's instantaneous right there. All right. That's very good. Let me check the other one. Good. Good. All right. That's very good. All right. I'm going to palpate your chest for any thrills, sound. All right. All right. Now between the fourth and the fifth intercostal space, the mitral valve, that's where you can feel the apical pulse here. So it has a short duration. The apical pulse has a short duration here. That's between the fourth and the fifth intercostal valve area. All right. So there is no thrills in all the precordium. That's very good. All right. Let me take this pillow. Go straight down for me. I'm going to auscultate 5 locations for your heart sounds. And I'll clean my diaphragm with my, where did I put it? I'll clean it, I'll wipe it clean before I use it. All right. And I'll start the 5 location by locating the second intercostal space, which is the aortic. Breathe, just breathe normally for me. I'm checking for the S1, S2 sounds. So this is the base area of the heart, and down is the apex. So this is the aortic valve area. That is between the second intercostal space. And then I move parallel here to the pulmonic, which is the second, the left, it's on the left second intercostal space area. And in the third intercostal space area on the left, below the pulmonic, the first pulmonic is the Erb's point. Keep breathing normal for me. All right. And I move to the left lower mid-sternal area for the tricuspid valve. And then I listen for the sound of the lung, which is high at the apex. Then I move to the mitral area. This is to the left side of the mid clavicular intercostal space. All right. Between the 4th and the 5th intercostal space is the mitral valve. All right. I listen. So the S1, the loud sound, the lob, is very loud. It's louder in the apex of the heart, which is the mitral and the tricuspid. And then for the aortic and the pulmonic is the S2, the dot sound is very loud there. Now I'm going to use the bell sound, the bell part of my stethoscope. I'm going to go in the reverse form to listen for any extra murmurs, any extra sound, like a murmur S1, S3, or S4. So I go to the mitral valve. I'm not hearing any extra sound. The tricuspid, I move to the Erb's point, and then I come to the pulmonic point, the second space, intercostal space, and then I come to the aortic space. And all sounds are very clear. There's no thrills, there's no murmurs, there's no S3 or S4 sound there. Thank you so much, sir, for giving me the chance to do this assessment, this focused cardiovascular assessment on you. Thank you so much. The doctor will be in shortly to see you, okay?
You're welcome.